Delegates from 153 countries came together at the Durban 2016 AIDS Conference under the banner of Access, Equity and Rights Now for all people living with HIV and AIDS.
As everyone in this room has understood this week, I think a consensus has emerged that we are not done yet. We face enormous obstacles before we can truly contemplate the end of AIDS, and this conference has been an opportunity to have the tough conversations that are needed to overcome those gaps. And that, I'm pleased to say, is exactly what we've done.
Despite the long road ahead for AIDS research and development, there was an air of celebration at this Durban closing ceremony.
I have felt the energy and the excitement in the corridors of this centre from early in the morning until late in the evening for the last week. I'm excited and optimistic about the future of the global HIV response. The scientific insights and programmatic advances shared at this conference provide powerful evidence that we can beat this. Every day we have seen community, science, policy, rights presented in extraordinary ways. The work simply is not done.
South Africa's Health Minister, Dr. Aaron Motsoaledi, said the world could not fight HIV/AIDS unless it fought TB as well, as the two diseases were two sides of the same coin. And when it came to HIV, it was time to focus on getting men to play a greater role in prevention.
Adolescents and young women continue to bear the brunt of the epidemic. New HIV infections in the 15 to 24-year age group remain unacceptably high. We have to design multi-sectoral programs that address the needs of young women. Men need to see themselves as part of the solution rather than part of the problem.
And there was general agreement among delegates that while Durban 2000 will always be remembered for the South African government's AIDS denialism back then, Durban 2016, here in South Africa's hardest hit HIV/AIDS province of KwaZulu-Natal, they were inspired and leave with greater hope and determination for the future.
We have made significant progress in terms of research and development. There's conversation about vaccines. There's conversation about progress. There's conversation specifically about the continued fight and the need to keep funding going and to invest in research and development, finding ways to curb this epidemic as much as we possibly can.
Renadal Calm, CCTV, Durban in South Africa.